Welcome our guest to today's show. Margaret, welcome to the Cycle Podcast. Thanks so much for being here. I'm excited to chat with you today.
Thanks so much for having me today.
Yeah, I'm really grateful that you're here and I look forward to hearing more from you and all the things that you're doing. But why don't you just start off, tell the listeners a little bit about yourself?
Okay, great. Hi everyone. I'm Margaret. I live in Boulder, Colorado. My background's in health innovation. So I've worked for USAID. I've started a medical device company. I've worked all over the world in how we can improve healthcare for people. And currently, I'm building platform to help patients with chronic pelvic pain and endometriosis. We have a mobile app, and then we also are building some tools for providers to help them better manage patients.
Oh, I'm really looking forward to diving in more to chat about that. And thank you for all of your work in helping people with medical innovations, because as everyone listens to the show and as a patient myself, we all know that the endometriosis space needs that innovation. That is for sure. Well, so I want to talk a little bit about it and we'll introduce the app and everything, but why are you passionate about this? Is there a personal health journey that you've had? Can you tell us a little bit about why you're doing the work that you're doing?
Yeah, definitely. So, during my career, this whole time I was having chronic pelvic pain, and I kept going to the doctor and saying, "Hey, I'm in pain most days. Like, is this normal? Like, what's going on?" And I just was told that's normal, or that's weird, or nothing we can do, or it's just in your head. And the years went on, and I went back and added it up, and I went to 25 doctors trying to figure out what's going on. And this is a mix of ER visits, urgent care visits, primary care, OB/GYN, GI, allergists, just bouncing all over the place trying to find some idea of what was going on, and no one had any idea. And I started this company actually before I had my diagnosis, because I was so fed up, and I started talking to friends and realizing that my story wasn't unique at all. So many people were in this space of having these symptoms, being gaslit by their medical providers and not able to find an answer for what was going on. Fortunately, since then, I got diagnosed with endometriosis, had my first surgery, and I also got diagnosed with celiac disease. And I think I'm very fascinated in just the way. I don't know anyone who just has endo. Everyone always has like a couple chronic conditions, and that
Mhm.
can really change how the symptoms present, and how can we get smarter at understanding how coexisting conditions present in patients.
Wow. That there's a lot to unpack there. So you were just working already kind of in the medical innovation space and we're struggling with your health yourself with the pelvic pain like you were mentioned. Do you remember when that started, or was it, in line with when you were working?
Yeah, so I don't remember too much about like my periods like back in high school. Like I remember them being painful, but just thinking that was normal.
Mhm.
Um, and I didn't really start talking to my provider about it until college, when my periods were so bad it was just hard to go to class sometimes, and that's when the conversation started getting dismissive.
Yeah.
But then I had a decidual cast. Are you familiar with that? It's when
Nope.
your entire endometrial lining comes off at once. So instead of like little over time, it comes off in a giant chunk. And it's the most excruciating thing I've ever experienced in my whole life. And I
Oh my
think
God.
since after that, all of my like normal endo pain felt minor compared to this experience, which I felt like I was dying, and it totally changed my pain scale. Um,
Yeah.
so I think part of it was, I then started to gaslight myself and be like, yeah, I'm in pain, but it wasn't as bad as that one time. So I guess it's okay.
For sure. I mean, that's such a good point that you bring up. I still do it all the time where I'm like, well, it's not as bad as this. And I'm so grateful because I could feel so much worse. But our pain is valid no matter how minor or major it's still valid. But I think
Right.
I know we have to find ways of like sometimes justifying it. And yeah, I don't know how to get out of that loop, but
Yeah,
I definitely do that too. Okay.
for
So
sure.
then that happens. And then you start to you're having all of these what are some of the other symptoms? Because I know you said you went to 25 doctors. I think it's really helpful for people to hear. We talk about symptoms a lot on the show, but there's always times that exactly what you said with having celiac and endo, I do feel like most people that I've met with endo do have something else, but then it makes it so hard to diagnose what's going on because you have a multitude of things going on. So, what were some of when you're seeing all these providers? What was going on?
Yeah, yeah. So the most consistent symptom was pelvic pain, and I think it was so confusing for doctors because it would jump around. So with celiac, it's upper left pain in your duodenum, and that was constant all day, every day, upper left pain. And then with endo, it was lower left and lower right. And that would be aligned with my menstrual cycle. So it'd be like one day it's upper left, and now it's lower right, and now it's lower left, and
Like
now
it's
it's
traveling. Where is it going?
exactly. But I remember a lot of times just like laying in bed and turning to my husband and being like, when you like think about your abdominal area, like what do you feel? Like, do you feel like tightness or pain or pulling or stabbing? And he's like, I don't even notice it. Like, I don't feel anything. And I'm like, yeah, that's probably normal. Like,
It
but I was
was
just so used to having just floods of
something.
sensations and something
Yeah.
going on all of the time.
Yeah.
And then the endo stuff was more cyclical. So I would have pain that would start about a week before my period, the week during my period, and the week after. So basically I had 1 week a month where I wasn't in pain, and I call that like my power week, and like the week I could actually like feel like myself and feel like a human. Um, but
I
yeah,
feel
that's
this. I feel that. Oh my gosh. Yes.
yep, yep.
Yeah. That's helpful though. I mean, that's helpful to have that background information. So, how are you doing now? What's going on in life now? How are you feeling? What's your health?
Yeah. Yeah. So I got diagnosed about 18 months ago. Um, all five of my siblings also got diagnosed at the same time as me. We'd all been overlooked for our whole lives. So it's
Wow.
been a family experience figuring out the gluten-free diet together. Um, and then I think in some ways that delayed my endo diagnosis because I was really pushing for an endo diagnosis at the time, but when I got diagnosed with celiac, doctors were like, "Oh, well, it's probably just celiac. Like, wait a year, go gluten free, see if your antibodies go down, and see if you feel better." So about a year after that, I was finally like, "Yeah, I'm still not better. Like, it's improved, but there's still something going on." So I had my first laparoscopic excision surgery in January, and that's mostly recovered. I think I had a really, really easy experience with surgery and recovery, and it's been great. I think you have this moment post surgery when you realize like it doesn't fix everything, right?
Yeah.
And so it can be discouraging when I still have pain days, but it's gone from 3 weeks a month to like 3 days a month. So it's a massive improvement.
That's incredible. I'm so grateful to hear that. I mean, I'm so grateful to hear I mean, not grateful that you have 3 days of pain, but it's so much better than 3 weeks of
So
pain.
much better. Yeah.
And just the realization of I'm going to have this surgery. I mean, again, this is what I always thought, like, I'm going to have this surgery and everything's going to be so much better. It's hard to remember, like, in the beginning, or at least for me, it was, and I didn't know this is chronic, unfortunately. So we have to manage it on top of the other things that we do. So,
Right. Yeah,
which
definitely.
is part of the challenging part of having something that's chronic. I mean, same with celiac, right? That's also, you can't cure yourself from celiac, right? It's a lifelong no gluten for you, right?
Yep, yep. Lifelong no gluten, but
Yeah.
it is a little bit more linear of a condition, I'd say, because,
Right.
it's like, don't eat gluten, your antibody levels go down, you're fine.
Yeah.
But, with endo, it's so much more complex and personalized, right? You really have to figure out what medications work for you, like what, do you
Hmm.
like your heating pad, do you like your TENS unit, like do you like your CBD? It's much more complicated to figure out a management strategy.
So complicated. I feel like it's literally like a chess game. Like, okay, I'm going to move this piece. Does it help? Okay, it does. Then I add this other piece of some sort of treatment, but then I felt worse. So like, is it those two combined? It's a lot of strategy. Exactly what you're saying. Like, I feel like I've used strategies and then sometimes they don't work. And I'm like, but they worked last month. Why don't they work this month?
Right.
So that's it. That's the challenging part about endo. So, okay, tell us about this app that you have developed and what it does and why you developed it. Just maybe tell us, like, start from the top.
Yeah. Okay. So when I was having all these health issues, I started interviewing a couple, at least 100, maybe 200 women who had endometriosis and other chronic health conditions, and hearing their stories and kind of seeing what the gaps were in the space. And then my husband is my co-founder with this company. He does AI and machine learning for predictive health analytics, and so we,
Wow.
dream team, we
Oh
both
my gosh.
quit our jobs and started building, and decided, there needs to be tools in this space to help patients. And there's so many opportunities to use AI and machine learning to improve the patient in the diagnostic experience. So we're still super early. Like, we have a huge vision of what we want to do, but
Yeah.
currently we have our mobile app that's live for patients, and that's really looking at three things. So one is how patients learn about their condition. We compile all of the peer-reviewed literature about endometriosis into a 12-week program for patients to learn to go through when they're trying to figure out if they have endo or when they're first diagnosed. We've worked with Heather Guidon and Sally Sorrell and all the endo superstars to help put together this material and put it at an eighth grade reading level so that it's approachable and accessible. Because I worked in the healthcare space. So when I was figuring out if I had endo, I read all these peer reviewed papers, but I think most people don't want to be reading peer reviewed papers. And oftentimes they're
Yes.
behind paywalls. And so, how
Yeah.
can we give people the information to make informed decisions about their health? So, on the learning piece, it's not a program where we're telling you what to do. We're giving you the information, we're saying the research, we're saying what's helped other people, and giving you the data to make that plan for yourself about, what do you want to have surgery, or do you want to try a more holistic approach? Do you want to go on hormonal medications or not? And both choices are equally valid. We just want to make sure patients have that information.
Right. Because as of right now, it's very hard to get the right information, especially when you start. I feel like I've learned a lot along the way, but to have something that would at least break down these are some of the options that you could try would make things just a lot easier.
Yeah, and because I would interview people who had been diagnosed with endo for over a year and had never even heard of pelvic floor therapy and never had a
Yeah.
doctor suggest that. And that's just wild to me, things that can really change lives and help people, and they're not even being told that this is an option for them. Yeah. So that's the first piece, is the learning. The second piece is the tracking piece. This was more of a, a personal vendetta of me trying to use all these apps to track my symptoms and being frustrated by, one, so many of these companies were made by men and were just selling women's data to Facebook. And
Yeah.
I was like, this is unethical. And two, something that was customized enough that I could actually track all the complex symptoms that I was having, because it wasn't just when I was bleeding. Like, there was so much more to that, and I wanted to be able to, track that. And then I also had this like vision of like the graph I wanted to see, which was my symptoms tracked over my menstrual cycle, to see which symptoms were correlated with your menstrual cycle and which weren't correlated with your menstrual cycle. And I was like,
Genius.
I need that.
Yeah, because people may have different symptoms when you're not on your period, exactly what you said, but like ovulation, I've heard different symptoms. And then it's, there is a cyclical effect of
Yeah.
symptoms.
And it can give a lot of insights. So for me, for example, my upper left pelvic pain was celiac and not correlated at all with my menstrual cycle, versus my other symptoms were. And so that can help you figure out what is maybe the cause, and what are the multiple causes of the pain sources.
Right.
So our app's fully HIPAA compliant, encrypted at rest and transit, super secure, super safe. We never sell anybody's data. Um, and then the last piece is the community. So, kind of built off this idea of everyone I knew with endo kind of had their their endo mom, like their friend or somebody they met who had endo, who was like 5 years down the journey from them. and
Yes.
and I thought about, like, well, someone newly diagnosed, like, they might not have that person they can go to for
Yeah.
questions and for support. And so there's a way you can create a profile and connect with other users and build out your little support system. And then as you post daily updates about how you're doing each day, your little support group is notified and can send you a message or send you a meme or send you some tips and advice.
Oh my gosh, I love that. I need to download this app and start using it immediately. Okay. So people are probably like, well, what is that? Tell us, how can we find it? Where's the website? Tell us all about that.
Yeah, the company's called Lasa Health, Lasa. It's on Android and iOS. Right now, it's just available in the US, but if you're from outside the US and interested, you can send us a note and we'll let you know when we've expanded it beyond the US. Yeah, you can download it in either of the app stores. Um, we launched a couple months ago, so we're still super new. And really, we ask people, when they download the platform to be part of building this with us, right? This is really just the V1, and we're looking to make it an amazing resource to help patients manage their condition. And so when you download the app, it asks you to take a monthly survey to give feedback. And so if you could please take the monthly survey and give feedback, that would be amazing. That helps us with two things. One is helps us understand like how we can make the app better, what we can change, what we can improve, but also helps us collect the data that we need to get this type of comprehensive endometriosis care and management support covered by healthcare providers and insurance companies, which is part of that bigger vision, is that we need to have all of the stakeholders involved in raising the standard of how endometriosis patients are cared for. So we're trying to demonstrate here's the value that providing this resource offers, and here's why every single OBGYN clinic and every single employer and every single insurance company should be providing this level of care.
Yeah, absolutely. Wow, incredible. So yeah, I want to hear more about the bigger vision, and then, if people have concerns about data or things like, I know that that's common, and I know you said it's HIPAA compliant, but tell us about the bigger visions. I would love to hear about that. And then we'll talk maybe just a little bit more tactical about any concerns that people may have. And I'd love to hear what you've learned so far. I know it's early days, but I'd love to hear more about that.
Yeah, definitely. Um, Okay, so bigger vision is we're looking at how we can use AI and machine learning to improve the diagnostic and management process of chronic conditions that impact women. So you look at diabetes and heart disease and these spaces that are so funded and have billions of dollars in research funding every year, and the
Mhm.
amazing innovations that they're doing. We're trying to build the same thing for women's health conditions and say, there's just as many people being impacted. Just because they're women doesn't mean we shouldn't build products and innovate for them. And so, we're working with a lot of healthcare providers and employers and insurance companies to help them really understand the what they're wasting. So endometriosis costs about $100 billion annually in the US, but no one's really talking about it right now. And so by helping them look at the data and understand their data and understand when somebody like me goes to 25 doctors to try to get diagnosed, that's a huge waste on the healthcare system. That's money
Yeah.
out of your pocket as an insurance
Yep.
company.
Yes.
And by helping them understand that bigger picture, we're able to get more funding, more support to build better products, better innovations, and hopefully cures for endometriosis.
Yeah. Yeah. Because at the end of the day, they're spending more money for us to see the 25 doctors or whatever than actually providing support for the disease. Yeah.
Exactly. Yep.
Okay. So I love that bigger vision, and it'll be great to have the data. So we're talking about data a little bit, and I know people get very nervous about data, especially like personal medical data. Tell us a little bit about like how are people protected if they're nervous about putting information in here, how the data maybe is aggregated, so it's, if it is communicated, it's all obviously confidential and encrypted and all of those fancier things that I probably don't understand as much as you, but I feel like people will appreciate knowing that so they can feel secure using the app.
Okay. Yeah, definitely. So the app is HIPAA compliant, and basically what that means is we have agreements signed with the cloud provider, the with Apple, with the people who host the platform, and all of us are using HIPAA compliant software and agreeing not to sell data. So kind of the whole tech stack from us to all of our cloud partners is compliant and secure and safe. So the data is encrypted at rest and in transit, and so that means that like when it's on your phone, it's encrypted. When it's pinging the server, it's encrypted, so that there's so that it's safe at all those moments in case of hackers or things like that. Um, and then I think from a user standpoint, so when you download the app, you list a name, right? Like what you want the app to call you, but it doesn't have to be your real name. You don't have to give us your last name. Like you can stay anonymous and private. And even like on our side of things, like I can't see who you are. Like I see this like 20-digit like character number of you're just this user. And because we have all these layers of encryption, that it keeps it super secure. And then if you ever change your mind and want to delete your data, you can just delete your data and delete it completely as if you've never had an account on our platform at all.
Awesome. That's great. Yeah. So just for people to, if you're like encryption, what is all that stuff? Basically, like it would never say Melissa Boudreau logged that she had, nausea on this day, da 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 da. It's just a number of person that can be aggregated together, probably to create some amazing reports on the back end to look at some of the trends and things like that with the disease to help with the bigger vision that you're talking about.
Yep.
Yeah.
Yep. Exactly.
So any initial insights or anything so far? I know it's still, again, early days for you, but anything that you've learned in the past couple months?
I mean, so much. Like the community has such great ideas of resources and things we can do, and I love that we've kind of built this space of where people can have ideas, and we'll say, yeah, we can build that and launch that next month. Like, let's do it. Let's work on it together. So we're starting to formalize a few things. So we're putting together this Lasa Health ambassador program, which basically is our like super users who get invited to focus groups where they can help give feedback about new ideas and test early release versions of new products. One of the big things I've seen as in the user's data is just the huge mental health problem. And that's been something that's been like keeping me up at night, is figuring out like everyone is really depressed and anxious, and it makes sense. And I've definitely experienced that too. And we've all been through a basically PTSD with medical gaslighting, and that has really impacted people. But yet, even when people try to seek care from therapists, those therapists are usually not informed in endometriosis and don't understand. And so about a month ago, we brought on a therapist who has endometriosis onto our team, and she's been helping us build out some new mental health resources that will be added to the app this summer. And then we're also starting some support groups that she'll lead. So that I think we'll announce that probably like on Monday. But so by the time this podcast ends, that will be live.
This
so
podcast, we're recording just so everybody knows on May 5th. This will probably not be going live till June or July. So it will be live. Wow, Margaret, that's incredible. That's such an impact to see that and to immediately add these support tools for people.
Yeah. I think it's so huge, and the pain brain connection is really studied, but yet I find that like I was at the endometriosis summit in March, and it was amazing, love it, but they didn't talk about the mental health piece like hardly at all. And it is really a big concern for a lot of patients who are struggling with relationships and fertility and these really huge things that are going on in their lives. And so we really need to have comprehensive approaches and treat the full person. So when we saw that we didn't really have the resources we needed to support patients in that way, we were like, okay, we gotta build some new tools.
I mean, that's absolutely incredible. And going back to the mental health thing, I've struggled with anxiety on and off for most of my life, and I really haven't been open to talking about it. And I was talking to an endo friend about it, and they were like, you just need to be more open, and talking about it might help. And I was like, I just never thought it was related. I thought it was separate. But I agree with you. Like a lot of, for me, like my gut has been severely impacted from endometriosis, and the gut brain connection with anxiety and just like nausea and all of that, it's so related. And even just to have a resource of someone saying, no, this is related, would almost give me relief to just hear that instead of thinking like these are separate things. And so I think that's such a great resource. And the app is free for users to use, or is there a cost associated? Okay.
No, it's free. So as we add more features, like the groups that the therapist is going to lead, there'll be a fee for that. But the base app, the tracking, the learning, that's all free.
Wow. I can't thank you enough. I can't wait. I mean, I should have downloaded it. Sorry, everyone, before the podcast. I've looked at your website, I've pulled it all up, but I was like, I want to wait until we chat before I download it. So I'm very excited to check it out. Is there anything else you want to add or just say to the endo community?
Oh man, uh, I mean, I feel so honored to have so many women tell me their stories, and people, not just women with endo, but I feel like I'm in this position where, I'm constantly having people reach out and telling me these heartbreaking stories. And, I have endometriosis. And so, like, I feel like I should be able to relate. But, like, really, everyone's experience is so unique. And there's no need to compare your experience to other people's. That, it's easy to say, well, mine's not as bad as hers, and like, oh, well, I don't have that symptom, or at least I don't have endometriomas, or at least I didn't have infertility. But whatever you're experiencing is valid and matters, and deserves to be heard and seen by peers, by family members, by medical professionals. And it's so sad that we've been put through this experience, that we doubt ourselves and we question ourselves. But if I could say anything, it's just to validate each person's unique experience, that it matters, and you deserve support, and you don't need to compare yourself to other people with endometriosis at all.
Yeah. Yeah. 100%. I agree with that. And, when we were talking about mental health earlier, one person I wanted to mention too is Corinne Fox, talks openly about her endometriosis and also anxiety. And so I think she's just, if anyone's listening, she's works with some different organizations, and I feel like she's a good person to just follow. I don't think she talks about it a lot on her social channels, but she does openly mention that her mental health has been severely impacted by she's had bad anxiety, but then she's also had endometriosis, and so she's really trying to bring awareness around that. So just I wanted to mention that, to circle back to that. But yeah, I can't thank you enough for the work that you're doing and offering this to patients, and just people's health in general, but specifically a lot of women's health has just I talk to a lot of people that may not have endometriosis but are affected with something else like Lyme disease or MS or something, that they're affected but they're female, and it's just they struggle, or they identify as female, they struggled very similarly as people with endometriosis, because the gaslighting and the you're being emotional or it's all in your head, and just in general, that's just some taboos that we need to break. And I feel like it's getting better and we're getting closer to doing that. But tools like what you're providing, where data can actually show people, I think is extremely helpful. So
Definitely, yeah. And
yeah.
I'll put in one more plug, but we're building a data set of women's health conditions. And it isn't just endometriosis. There's hundreds of conditions. Actually, there's over 700 conditions where women are diagnosed an average of 4 years later than men. And a lot of this is, yeah, I know it's crazy. A lot of this is because of the lack of data, and so we're building machine learning models to help physicians better diagnose these conditions that are overlooked by the medical system. And the more patients we have take our little survey, the bigger our data set is, and the more we can work with researchers and hospitals to improve diagnostics. So it's a fully anonymous survey. We don't ask your name, we don't ask your email address, we don't it's not for marketing purposes. It's really about building this giant data set so we can raise the standard of diagnostics and catch these conditions that have huge delays in diagnostics. So you can take that survey on our website.
Okay, great. And your website is, just remind us what it is. So
It's
people, I'll also link it in the show notes, but yes.
yeah, it's lasahealth.com.
Yep. And it's,
LASA
yep.
health.com.
lasahealth.com. I'm on it right now, and I'm just very grateful we got to have this conversation, and for your hard work on this. Seriously, I'm like overwhelmed with how excited I am about
Oh,
about this and just the data, and I can feel your passion for it, and I know it's going to make a difference. So
yeah. Yeah, it's a lot of hard work, It's a lot of
yes.
a lot of sleepless nights, and my husband and I just like hunkered down living at my parents' house trying to like save money so we can build out these platforms. But like, I think that's what you need, like this, to really make change. Like, it takes sacrifice and it takes work and it takes a community of people coming together and saying like, this is not okay. Like, I can't live unless we change this, and I'm going to do whatever it takes to make this system better.
You're absolutely incredible. Yeah, I guess before we wrap up, I do have one more question. What has been the most challenging part about all of this, putting this together?
Interesting. The most challenging part. Um, I, I mean, the most challenging part is honestly the the financing side of,
Yeah,
if somebody was doing this in the diabetes space, they would have like $100 million of investment to work with and like all these
yeah,
grant fundings and everything. But because this condition is stigmatized, and because most investors are men, and it becomes a really barrier to having the resources that we need to build what we need to do. And so,
yeah,
we've definitely explored, like, how can we support this, and how can we make keep our resources free for patients while
yeah,
being able to scale up our team and hire the people. So we're always on the lookout for people who support our mission and want to support our business, and we're also exploring some ways to allow users to kind of come on and support our platform as well with a small contribution. So if you want to help out, if you like our mission and want to see how you can help, just reach out, and we're happy to connect you to with different resources and ways to get involved in supporting our business.
yeah. And that's kind of why I wanted to ask that, because I've never built something like this, but I work in marketing. I've worked with a lot of app builds, and this is way more in depth than what I've had to do. And I just know the time and the effort and the expense for doing this. So you are doing an amazing thing for the community, and I will definitely be cheering you on and supporting you guys in any way that I can. And just want to say thanks so much for chatting with us today, and taking time to do this for others.
Yeah, well, thank you for having me, and thanks for all the work you do with your podcast. I think it's so important to tell the stories of patients, and that's just so validating. When you first get diagnosed and you've never met anyone with endo, to have a podcast you can go to and hear the stories and hear what's helped other people, and realize you're not alone. So, love what you're doing. Thank you for your
Thank
support in the
you.
community.
Oh my gosh, of course. I appreciate that. And yeah, one of the reasons when you mentioned you talked to 200 people, that's making me think about when I originally started the show 4 years ago. I was like, I just wish I knew this, or I wish I knew that, because like you said, it endo affects everybody so differently. And with the variety of stories, when you can go listen to them, you may identify or relate to something with one person's story that maybe exactly like how you mentioned, I may not have this symptom, but I have this. And oh my gosh, it is all related, right? So I never wanted to be like a technical medical show. I wanted a place where people could come, tell their story, to help other people, but also it's kind of healing for people to tell their story, I think. But then other people can listen and say, oh my gosh, I never knew that this shoulder pain could be thoracic endometriosis. I've learned things on the podcast that I had no idea was related. So I'm sure you found that correlation when you were interviewing patients too. So thank you for those kind words and coming on and chatting with us. I have a feeling you'll be back. We're going to talk about something in the future. I have a feeling. So thank you so much again for being here.
Well, I'd love to be back, but thank you so much, and I'll keep listening to your podcast. Take
Thank
care.
you.